Hi all, Professor Neary here again, and just want to talk to you a little bit about the components of nursing theory, which is one of the topics for the course. Also, you could call this the structure of nursing knowledge. Sometimes when you write components of nursing theory, it's a little bit broad and difficult for students to completely understand what that means because there's other components besides what we're going to talk about. So if we talk about more of the structure, the way nursing theory flows, that's kind of the concentration we're going to be taking in this discussion. So get these slides to move. Okay, so for our purposes, the structure of nursing theory is on a continuum from most to least abstract. And so if we have nursing theory over here, the broad name nursing theory over here, the biggest concepts are the meta-paradigms. They really wrap around all of the concepts within nursing. Then we go to philosophies, and then nursing philosophies, which again are very broad statements. The nursing models, and under nursing models are also something called grand theories, and I'll explain that in just a minute. And then we have nursing theory, middle range theory, and then practice specific theory or situation specific theory. You may hear it in those terms also, are the very least abstract and the more concrete of the types of theory. So your textbook does a really good job of outlining these. I believe it's going to be in your chapter 3 in your textbook, and there's a whole section on, and it's only 2 or 3 pages long, that really hones in on what are the differences as it moves down. The one thing your textbook doesn't focus a lot on is this practice or situation specific theory. Those are the newest types of theory in nursing, and so it really isn't delved in much with your textbook. So a broad overview of the concepts. We're going to start out with the nursing meta-paradigm, and you're going to really focus on that in another assignment, so I'm just going to touch on it here. The nursing meta-paradigm is the broadest of all of the discussions. The nursing meta-paradigm applies to, isn't made up by one person. There isn't a nurse theorist name that's absolutely attached to the nursing meta-paradigm. It is something that are the broad concepts that are involved and expressed in all of the nursing theories, some to more extent, some to less extent. And we'll talk about that as we move forward, talking about specific theories. But no one theorist owns the nursing meta-paradigm. Nursing owns the nursing meta-paradigm. And the 4 main concepts within that are person, environment, health, and nurse. And in a sidebar, you will see some newer text and newer articles that say that caring is also a meta-paradigm that belongs to the profession of nursing. Because it is not an accepted part of the meta-paradigm throughout all of nursing literature, I haven't put it here in this course, but stay tuned. In the next few years, I'm sure it will be a 5th part of the meta-paradigm. So moving down the level of abstraction, we go to philosophies, which are still pretty abstract. And so I hope that you all have learned about philosophy. I'm not going to teach you anything about philosophy here because philosophy is a worldview. Basically, how do you see the world? And hopefully all of you have at some point had a class where they had you write your philosophy. You may have done that in your professional nursing course here. So I think you guys have an idea of what that is. So basically philosophies give general meaning to nursing phenomenon. It's a broad overview of concepts that are unique to nursing practice. And they attempt to answer some very broad questions like, what is nursing? What is the nature of human caring? What is the nature of nursing practice? And what is the social purpose of nursing practice? And you can see that probably if I answered those questions, it might be a little bit different than if you answered those questions. And so our philosophical framework might be a little bit different. And so there are some nursing theorists out there who have written broad statements of nursing to discuss the overall concepts that involve nursing. Okay, so conceptual models, and there should be a slash there, grand theories. Those two are often words you will hear that can be combined. They're very close to each other. They are both really big propositions, or they have big concepts within their theory that are very broadly explained. They are more specific from philosophy, but they're still pretty expansive. And I'll give you some examples of those in a minute. Nursing models, they provide the broad worldview of nursing meta-paradigm concepts. So they discuss the definition of nursing, but it's very broad and very expansive as opposed to just a couple little sentences. It really does do an overreaching discussion of what nursing is. Okay, nursing models tend to be named for the person they're developed for. So you can see some examples here, and these are the ones we're going to be talking about in this course. When you are answering your discussion questions in the week that we're doing models, theories, or whatever, you're going to be focusing on the models that the course is focusing on, or the theory that is being focused on that week. You're not going to be moving back and forth between models and theories. During certain weeks, we're going to be focusing on certain things. But for this discussion, the models that we definitely will be talking about in this course are Johnson's behavioral systems model, which is pretty expansive. It talks about all different kinds of systems and subsystems, and I'm sure that you all have learned systems theories in the past, but it talks about how those integrate, how nursing systems within the nurse themselves affect the systems of the patient, and all the different systems and subsystems, physical, psychological, social, affect the patient. We have King's conceptual system and theory of goal attainment, Newman's systems model in nursing practice, Orum's self-care deficit theory in nursing practice, and you'll see Orum's name flopped back and forth between conceptual models, theories, because her model is actually broken down into smaller theories. And understanding when we're talking about this structure of nursing knowledge, that the lines are fuzzy. And so some things in some texts you'll see things written as a conceptual model or a philosophy, and in some you'll see them written as a theory. A good example in this course is we're going to be talking about Jean Watson when we're talking about philosophies, but in some places you will see her mentioned as either a model or a theory. So again, it is just to show you that things go from broad to very much more concrete, and that while there is that wiggle room in this course, we're going to kind of try to stay focused within our weeks of study. Okay, lastly, conceptual models are broad frameworks that guide either a whole healthcare system or departments of nursing, and you all are going to be doing an assignment on that, and we'll talk more about that as it gets closer. And then nurses use both nursing and non-nursing models to guide practice. Centera Health System right now uses a model called relationship-based care. So it is a non-nursing model, but it guides this health system and many of the nursing departments. So nursing theory overall are basically derived from models. So there's this big, huge model, and it is taken and kind of broken down to do a more, or at least a less abstract theory. Theory guides the structure for reasoning and actions. We take that information and we really put it to practice at the bedside. It gives us more concrete information to put at the bedside, where with the philosophies and with the broad models, you may be able to operationalize them a little bit in the way you would like, if it fits it, where with theory, it's a little more driven down so that your actions are a little more precise. And also the propositions and relationships can be tested. So while still not as super easy to do research on, the theories, it will provide the basis for nursing research. And some are the nursing process theory, modeling and role modeling theory, Leninger's theory of cultural care, which you probably all have heard of, Paplau, you all are already using, whether you know it or not. You've been using it since Dr. King talked to you about therapeutics and therapeutic communication, and then Henderson's 14 basic needs theory. Middle range theory is one of the newer types of theory out there. It is more narrow than models and grand theories and theories, obviously. It's more easily applicable to particular settings. Where we just talked about grand models are really broad and nurses operationalize them a little bit differently. You get into theories, it guides that practice a little bit more succinctly. You get into middle range theory, it pretty much tells you X, Y, and Z, and this is how you operationalize it, and these are the concepts that are within it, and these are the variables that affect it. So it's a little bit easier to study and a little bit easier to apply to practice. It often implies an expected outcome. We have, and I'll talk about in just a second, Joanne Duffy's quality caring model, which was derived from Gene Watson's caring theory, has an expected outcome of quality care. So she says that nurse caring results in quality care. Period. And so she doesn't say that nurse caring results in the best wound healing. That isn't what her theory says. Her theory says that nurse caring actually results in better overall quality care outcomes. And there's a whole lot to her theory, so that's very basic in a nutshell, whatever. But going forward, because the narrow nature of the concepts and relationships in the theory, again, more amenable to research, they can be developed through a process called the grounded theory, which is a qualitative research method, which we're not going to get in detail in this class, but you can start with a theory, or you start researching something in a qualitative method using a grounded theory approach, and then the end result is a theory. Some examples is, again, the quality caring model, which was derived from Gene Watson's caring theory. There's a theory of optimal client system stability, which was derived from Newman's systems model. And then the theory of adapting to diabetes mellitus, which was derived from Sister Clarissa Roy's adaptation model. All right, so practice-specific theory is now the least abstract and the newest type of theory out there. It really pertains to one specific population and one specific practice setting. And so here's some, and again, there is this wiggly line between middle range theory and practice-specific theory, so sometimes you'll see a lot of interplay back and forth as to what they're called. But I think if just by using these names and these examples, you'll see how specific they are. So in the first theory, situation-specific or practice-specific theory that I'm noting here is the situation-specific theory of heart failure self-care. It doesn't have to do with how a nurse manages heart failure in the hospital. It doesn't have to do with the medications that a care provider gives the patient. What it has to do with is the patient's self-care when they have heart failure. Very specific diagnosis, very specific context. The second one, situation-specific theory of Caucasian cancer patients' pain experience. Now that's pretty specific. The patient has to be Caucasian, they have to have cancer, and they have to have pain. And then you can apply the concepts of that theory. Now you could test those theoretical concepts in other situations to try to expand that theory, but right now the theory cannot be used or cannot be valid and reliable use on populations outside of what it specifies. And the last one is a situation-specific theory of Asian immigrant women's menopausal symptoms experienced in the United States. That's pretty specific. And so I think just by seeing sometimes these names, and if you look at those and we go back to the philosophical ones in the beginning where it was Gene Watson's theory of caring, wow, that's big. All nurses should show caring in all situations, and there's different ways to express it, and so there isn't that one way of doing. And then you come down here to these, and this is very specific. So hopefully going through that discussion helps to delineate that structure that at least Allie Good, now you won't see that in all text, but the text